colleagues, we are at the top of the hour. Welcome to our echo session today. Good morning, good afternoon, good evening, depending on where you're joining us from. My name is Francis Ochen from the African Society for Laboratory Medicine. I am your moderator today. Our session will run for 1 hour. We'll take shared presentations and then get to the questions and answers. Kindly join the discussions through the chat, and that is your only option to join the discussions. Do not share your personal information for data security reasons on the chat. We already have all that we require from you in terms of information regarding this session, and that you provided during the registration process. We do have language interpretation services. Please keep to either English, French, or Portuguese, depending on your language of choice. Our session slides and recordings will also be made available to you through our multiple social media platforms, and so you do not have to worry much about that. Today, we convene a second session of a series that is dedicated to optimizing procurement and supply chain. And this series is made possible given the collaboration that ASLM has with USAID, Global Health Supply Chain, Procurement and Supplies Management Project. In the first session, if you remember, sometime in August, we shared PEPFAR's experience in establishing molecular instrument-based service level agreements with global diagnostic manufacturers for viral load and EID. Of course, those concepts can apply to other instruments as well. But we also then walked you through the concept of the all-inclusive reagent rental model, essential elements of the service level agreements, and some key lessons that have been learned through the service level agreement implementation in a number of PEPFAR-supported countries. And in today's session, we have a second of the many series that we've promised us. And in today's session, we'll move further and dive into the establishment and management of key performance indicators under the all-inclusive service level agreement. We will also offer some practical insights on how to define the key performance indicators, their management, and the process and use of these key indicators in managing our suppliers and instruments performance across most of our network. We will also then look at one of the case studies from Zambia related to the use of key performance management in ensuring that our lab networks perform well in terms of supply chain. Our presenters today, colleagues, are three very distinguished presenters. The first is going to be Jason Williams, who is just going to give us some opening remarks. And Jason is a technical laboratory lead with the Global Health Office of the HIV and AIDS Coordinator at USAID Washington. And then the second presenter is going to be Richard Shimishigan. And Richard is a supplies performance data manager with the Global Health Supply Chain and Purchasing and Supplies Management, again with the same project. And then the third is going to be a presenter from Zambia, who is giving us the country level experience. And that presenter is going to be Zephania Matonga. And Zephania is the National Laboratory Logistics Coordinator with the Ministry of Health in Zambia. So colleagues, join me in welcoming our first speaker, and that is going to be Jason Williams. Jason, over to you.
So good morning. Thank you for that, Francis. I don't have much more to add beyond the overall program description that you provided, but I would like to thank everyone for taking the opportunity this morning, this evening, or this afternoon, depending on where you are in the world, to listen to the follow-up from the previous presentation in regards to service level agreements. KPI management is actually a pretty critical component of the successes that we've had, obviously within PEPFAR, which we highlighted in the previous presentation. And I think it's important not only to understand some of the KPI aspects that we look at, but also understand the level of effort required to monitor and to manage. I think some of the key takeaways for me is establishing minimum performance metrics and obviously holding colleagues as well as manufacturers accountable to those. So again, I will hand it over to Richard to get more into the weeds on the overall KPIs themselves. I would say that we have standardized them within PEPFAR across all of the manufacturers. We're actually measuring Abbott, Roche, Hologic, Cepheid, essentially using the same KPI metrics, which is great because it gives us an opportunity to do comparisons more globally and allows obviously country colleagues that are using these machines and implementing these similar KPIs to understand who's performing better than others within their particular country. And that obviously provides leverage in regards to follow-up and potentially recompeting service level agreements and instrument swaps and those sorts of things. But I'll hand it over to Richard. But again, I'd just like to thank everyone for joining this morning, this afternoon, or this evening, wherever you're located, like I said. And hopefully we have a productive conversation. A lot of questions towards the tail end. I feel like this is one area that we don't necessarily coordinate too well on, from gaining information from the country level and bringing it up to global so that we can actually have productive conversations with the manufacturers at a more global level. So again, thank you all for attending, and I look forward to the conversations following the presentation from Richard. So with that, I'll hand it over to Richard, who can begin the presentation. Thank you so much.
Okay, thank you very much, Jason. I will pull up my presentation here, everyone. So thank you all very much. My name is Richard Schmidtgen. I am the Supplier Performance Data Manager with GHSC-PSM. We seek to improve, the ability of supply chains to perform functionally and to, smooth out the processes of, making sure that all necessary medicines get to where they need to get to as quickly and efficiently as possible. So today we'll be discussing laboratory performance management through KPIs, or key performance indicators, using our service level agreements that were discussed in a previous presentation. So here is our agenda. So first, we will start off with just the objectives of our session and some background for any of those who maybe weren't here for the last meeting or just need a bit of a refresh before we can get into more of the details. So what are our objectives for today? So first, we are going to share our own experiences, excuse me, on introducing this process of managing supplier performance using our service level agreements. We want to provide some insights on both what a key performance indicator, or what a KPI is, what it should cover, and how to set up a structure to perform that management. Then we would love to give our example, hopefully a useful example of how a country can implement this and what those impacts are. And finally, help all those on the call understand how to accelerate the process of making sure this is adopted widely among your country stakeholders. So we'll start with our background. So price transparency, service performance, market health are all huge parts of PEPFAR's efforts to improve laboratory testing across the world. So as we discussed in a previous presentation, the viral load and early infant diagnosis, that would be the VL and EID, which you'll see a lot today. We had 2 waves of requests for proposals that went out, one in 2019 and then again in 2022, that established these all-inclusive pricing for goods and services for the high throughput lab-based HIV viral load and EID testing in our PEPFAR-supported countries. So this all-inclusive model does include obviously the procurement of the reagent consumables, but it also sets up these various services that our 3 major global manufacturers have to provide, some of which are listed here, such as installation removal, user training, maintenance of instruments, instrument remote connectivity, and data reporting. And these services really are a very key part of what these KPIs or key performance indicators are designed to measure. So now we'll get into a bit of an introduction on the KPI management process. So we'll start off with the objectives and approach to KPI management. So our approach to the management of our KPIs under the service level agreements is to standardize our services and our contract terms across our suppliers and countries. So by standardizing this criteria, it makes it much easier to assess performance from one location to another, or from a supplier to another, and thereby allowing us to really identify areas that need improvement, or areas where there are successes that we could potentially replicate elsewhere. So we do want to highlight the second point, that the management is only effective when it's monitored against an established service level. This is a very key portion of the process, and this is something that we come back to on a very regular basis as a benchmark by which we use to monitor performance and identify when issues need to be addressed. So we have, and like I mentioned, we have a systematic approach, and we've developed a standard operating procedure and work instructions for the KPI management. So it again covers all suppliers, it covers all of our countries, and it is a standardized way of identifying things that maybe could be improved, or that we want to try and replicate. And in terms of what comes from all of this, so part of our model does include making a volume commitment, and furthermore, we just highly emphasize on our program the importance of supply planning and planning out volume allocations to certain suppliers. And certainly in cases where KPI levels have not been met, and where the performance has not been up to the standards that we have set for the suppliers, we do give countries the ability to modify who they decide to procure from, how much they decide to procure from them, and it empowers countries to then also go to those suppliers in order to try and obtain higher performance than what they would receive otherwise. All right. So now to get into what KPIs are most useful for managing diagnostic suppliers. So here is a list of the 10 KPIs that we have for our program, and I'll try and keep this brief in the interest of time. But so the first one we have here are making sure machines receive the sufficient number of preventative maintenance. So again, not just having suppliers respond to when there are issues, but also making sure that they are proactively going out and checking on machines, making sure everything is working, and preventing issues before they arise. Then these next two are very closely tied. So response time and repair time. So the first one here is the amount of time it takes the supplier to respond to a ticket that has been raised when there's some sort of issue. And the KPI number 3 here relates to the amount of time it takes a supplier to actually close a repair ticket. Instrument outage reporting here, we define this as tracking the number of times an instrument is prevented from being able to produce test reports within 3 months of a similar of repairs for the same issue, or from within 3 months of one of these preventative visits that should have proactively prevented that issue. And then when we say instrument uptime here for number 5, we are referring to just tracking the total amount of time that a machine is actually active and functioning. And then when we get to these next two, 6 and 7, these two I have marked because we have worked with suppliers to build out the ability for real-time monitoring on these KPIs, which is very exciting. There are some additional negotiations that have to take place with the suppliers in terms of establishing memoranda of understanding so that these can properly be implemented in accordance with all the privacy and legal regulations that suppliers are subject to, both in the countries in which they operate and in Africa, that is, and in their home countries. So the failure rate report, KPI 6, this is this is fairly simple. It's the number of tests that are failing when run and tracking that. And transmission uptime, again, for those that do have the real-time internet connectivity, tracking the amount of time that they are actively connected to the network and making sure that those networks aren't going down. Then we get into shelf life reports. Number 8, which is fairly obvious. This is making sure that all reports are, all deliveries meet the shelf life requirements set aside in our ordering agreements. Then we look at also just making sure suppliers are reporting on time and reporting what they're supposed to. We do grade them on that. And finally, KPI number 10, we have the on time in full delivery metric. So those are a very high level overview of all of those KPIs. So here, we do want to just share that I won't read everything on the slide for sure, but we do want to highlight that, in addition to just having these KPIs, we do have a much more detailed categorization of them and definition. So we have, general overall categories for what we're measuring in the KPIs. We have our longer definitions here, but then especially on the right side of the screen, I do want to draw attention to that. So we have our standardized targets. Again, this is very important to, we did negotiate this with suppliers and come to an agreement on what is the level we expect suppliers to make, and that if they do not reach this level, that will potentially trigger actions on either our part or the part of in-country stakeholders to find some sort of remediation and improvement of performance from suppliers. And then also looking at reporting frequency. So how often are suppliers required to report on these things? As you can see here, we have some metrics that we look at on a yearly basis versus others that are looked on a quarter-by-quarter basis, and some that are looked at on a month-to-month basis. In terms of doing a formal evaluation, we do, again, for example, KPI 6 and 7, we do generally, retain the ability to look at this on a day-to-day, week-to-week basis, but in terms of a more formal review process, that is what this reporting frequency column represents. And then we do want to highlight down at the bottom here that these represent minimum standards for services. So if, for example, in one of your countries, if you would like to implement something similar to this, we do say that, we encourage countries to feel free to take our example and to modify it based on what they feel works best for them, whether that is changing the targets, changing the reporting frequencies, or even adding new KPIs if there's something that you feel is important to your context that we have not addressed ourselves. So now we're going to look at the roles involved in this. So before we get much more into detail here, I do want to stress that country ownership through collaboration with the Ministry of Health is absolutely essential for following through with the effective and accountable KPI management that we're talking about here. So the only way this works is really if not only, for example, maybe like a procurement agency like PSM is involved, but you need buy-in from the suppliers, and also really from other in-country stakeholders. That's a crucial component of effective KPI management through these service level agreements. So the 4 roles that we have outlined here. So the first is the supplier in-country representative. This is the main point of contact who is going to represent the supplier themselves in a country-by-country context. This could be someone who is more a high-level representative. It could be someone who is a more, just a country-focused individual. But it is obviously important to have a representative from the supplier involved in your process. Next, we have our country representation. So this is usually someone from the lab technical working group or the Ministry of Health who can manage the relationship between the supplier's representative as well as the individual lab, someone who has contact there and is very familiar with what's going on there, as well as other key partners such as implementing partners or funders as well. Then we have a lab data specialist. So this is something that in our case, PSM provides this service. So this is the person who's responsible for storing data and monitoring it over time and providing all the necessary calculations. And then also we have the country SLA contract manager. So this is the person who is managing the business terms and is keeping track of those contract terms. And that looks at the KPI data provided by the lab data specialist for things like contract renewals or modifications or formal requests for performance improvement. So in this case, we have these 4 roles broken up here. These can be combined if in your country context, you find that to be preferable, or they can be separated out into multiple individuals. The important part here really is that all of these responsibilities are adequately addressed during the SLA implementation process. And now we're going to get a little more into the weeds still with our management cycle. So how does this work? So this is the GHSC-PSM model. For those of you who are interested in this, you can feel free to modify it as you see fit. We understand that this is not a one-size-fits-all thing, but this is the process that we have established thus far. So we start up at the top here. So quarterly, we have a report for all 10 of our KPIs that are submitted by the supplier. Once this is submitted, because we receive one for each country in which we operate, we have a designated country team that reviews and can verify the information therein. So looking at the number of tickets that were raised for repairs, the testing and error rates, and just making sure everything looks accurate. Then if there are any discrepancies found, we give feedback. Our teams will give feedback to the suppliers and request an updated and corrected version of this report that's submitted in this first step. Then once the suppliers have submitted an acceptable version, so sometimes you can skip this step. The report will go to our lab data analyst to further analyze and process the results. Those results are then translated into visuals, which are used as part of a quarterly performance review meeting. Excuse me, that is held between stakeholders and then each individual supplier. Now, for any areas where performance is substandard, we do have an action plan that we put in place, and we'll get into that in the upcoming slides. And then once an action plan has been put into place, the lab managers and then all supporting implementing partners are going to monitor it to ensure that the performance improvement is attained correctly. So now to get a little more into the poor performance. So how do we address? First thing we look at is the poor performance related to something that falls under the supplier's control, or is it something that's more outside of the supplier's control? So for example, when we say outside of the supplier's control, there could be other infrastructure issues, such as failure in power grids, user-related errors when it comes to loading reagents and consumables into the machine and not processing those properly, or just other delivery delays that may fall outside the ability of a supplier to really prevent. So in the event one of those issues comes up, that would be incumbent upon the country's internal team to discuss how to address these issues and figure out how to improve their own lab performance. So in the event we come up here and it is something that is under the supplier's ability to prevent, so a thing like a machine breakdown or part availability, high error rates from the machine. First thing we look at, did the poor performance take place over 3 consecutive months or 1 quarter, depending on the reporting process? If not, if this is a relatively new thing, then we just keep an eye on it and monitor it over the course of the next quarter to ensure it doesn't become a problem. This is where, for things like error rates, that real-time data monitoring is extremely useful. And certainly if anyone has any questions on how we use that, I'm very happy to respond to those. Then if it has continued though for a more extended period of time, the country representative, the contract manager, the Ministry of Health, and the supplier will agree on a corrective action plan, and very importantly, with a timeline to hold the supplier accountable for. So then we have to track, did the supplier actually complete this plan on time? And if yes, then we document this. We ask the country representative to keep documentation of this so that even though it is resolved, we have record of the fact that there was an issue in case such a thing arises again, and in case there are any questions as to why this maybe is not affecting the overall commitment of volume to the supplier. However, if the corrective action plan is not completed on time, then there are several potential penalties that can be pursued, whether reduction of volume in the future to reimbursements or reshipment of lost products. And then obviously the one thing suppliers hate to hear more than anything else is that you're going to take the tests you would purchase from them and instead purchase them from someone else. And so to expand a bit more on that last point, so how can poor performance be addressed with the SLA? So again, you can create this contingency plan. Most of the time there are fairly common solutions that can be found for these things. If the vendor is unresponsive, that is especially where we like to where we save the the major consequences of failure. So for things like those reimbursements or planned volume reductions, that's where that comes into play. And again, if for our personal, so again, this is just ours, you can feel free to modify as you would like for your own country contexts. For 3 consecutive months or 1 quarter, that will trigger us to initiate this process of corrective and preventive actions or corrective risk and risk management actions. And then the lab managers and those supporting implementing partners must ensure that this KPI data is used to continue making improvements on this. So making sure this is not just a one-time process, but that it is something that, if there's an issue, it's notified, it's addressed, and then we continue to track it and make sure that it does not become an issue again, or if it does become an issue again, that it is swiftly taken care of. All right, so now I think for the part we've probably all been most excited about, I will hand the presentation duties over to our colleague of ours from the Ministry of Health in Zambia to give an example of the case study where his country has actually utilized this KPI management process.
Good afternoon, everyone, and thank you very much, Richard, for that wonderful presentation. And indeed, Zambia needs to present on a case study. So we want to give a background of what we've been doing as a country. And we see that before the country went into reagent rental, we had struggled how to deal with the background, the backlog of viral load and EID samples. So that made it very difficult for us to meet the last 95% viral load suppression rate. But upon putting in place the measures and mechanisms, we see an improvement as a country. And in 2024, we are happy that we have now reached 97% suppression rate of the 1.4 million people living with HIV. And we just want to highlight also that Zambia has a population of more than 20 million. So looking at that is a stride towards the right direction, having put in place the implementation mode of monitoring the KPIs in the country. And working closely with the Global Health Supply Chain, Procurement and Supply Management team, we see their mandate being in effect, and they were able to provide a cost-effective and reliable procurement service that is helping Zambian government. So to understand it well, as it has been explained by Richard, we see that we needed to making sure that the standardized service level agreement are extended to all global diagnostic manufacturers who had to put platforms in our country where we can do the testing for viral load and EID on the convention platform. Then, having put them in place, we see as a country having an effective way of having commodities in our testing lab, as well as monitoring the instrument by having a remote connectivity. So all these to be achieved is by ensuring that the 10 KPIs that were mentioned by Richard were followed closely, so that we monitor both the vendor as well as the program performance. So after having the implementation of the program, what are some of the results, or what are some of the key interventions that we've done so far? Before the implementation of the KPIs, we saw long vendor repair response time. We had short commodity shelf life. Like I highlighted, also the backlog of samples. So it was also very difficult for us to monitor the performance of the instruments. But with the help of putting in place the KPIs, we see improved vendor response time and improved long commodity shelf life that are taken to our testing facilities with a very good shelf life. So having seen this, we see that monitoring the KPIs has enhanced the improvement of testing in our labs. And once we have a challenge, we see that the testing lab are able to communicate back to the vendor within the 48 hours and copying the Ministry of Health that in such an area, the instrument is giving challenges. So vendors are able to go to such an area to make sure that corrective action are put in place, and we are able to continue testing on our platforms. And what this slide is showing is the time response that has been reduced after implementing the KPIs. We see in 2021, before we had put in place in these KPIs, we had the long time response. But however, after some time, we see a fine example of response time by month. That is KPI number 2, where we see facilities are being attended to very, very quickly by the vendors. So we really appreciate that this KPI monitoring period has helped us so much that we have improved very well, and testing is going on without challenge in the labs. And this is an example of the KPI number 3, repair time. You are aware that, of course, there could be some repair time where it showed slightly higher in one of the graphs here, but the response is relatively okay, and this has reduced a lot of challenges. So to explain this spike that we are seeing here, it must be one of the labs that is far away from Lusaka. So to travel to such a lab, it took a bit of time, but however, we are happy to see that there's progress, and the time of repair has tremendously improved because we are able to monitor the time as well as the repair response from our vendors. Now, this slide is showing the good results that may be seen after putting KPIs intervention in place. We see the program had to identify areas of improvement, and we see corrective action instituted to prevent prolonged challenges of the equipment. And with what result? We see KPI number 6, non-conformity is not high, but we are with the ongoing user training and introduction of mitigation plan, we see an improvement in terms of errors as well as the machine breakdown in our testing labs. And also the ministry, working closely with the vendor and our partners, we had to target facility staff to institute trainings, ongoing trainings that helped to address the challenges of user in terms of the machine, as well as sample related errors that could occur prior. We had to introduce this intervention. So we see great improvement, and this is the right direction that the ministry has continued to working closer with the vendors so that improvement can be maintained. So this slide is just showing the error rate, KPI number 6, failure rate by month. But upon identifying the improvement areas, we see this improving every time. We saw a challenge in 2023, but we've seen significant improvement in the platform, that the errors on the equipment are actually reducing. So we really appreciate that identifying areas of improvement early helps us to reduce the challenges, and working closely around the root cause errors and hence improving the testing. So the error rate peak in 2023 appears to be slightly hard, but just decreased at the last end of the year, making it that this is the right way to monitor the KPIs in this area. So, in conclusion, what are some of the benefits that we've seen as a ministry, having put in place monitoring mechanism of the KPIs? We see that there is improvement in terms of vendor performance, and this also has helped us to have accountability of all stakeholders involved, so that we are able to work closely with the ministry to improve testing profile in our testing labs. In addition to that, we see an improved monitoring of reagent rental performance, because we are able to monitor. We can monitor remotely that this facility is testing like this, and we see also the program being owned by the ministry. It gives us the powers to actually monitor the performance of our vendors as well as other stakeholders that may be involved to improve, so that we can continue serving our clients very well without challenging. So in conclusion, the ministry is taking upon this program so that the monitoring is also enhanced at ministry level, at partners level, as well as other stakeholders. So we really appreciate that having put a mechanism to improve the key performance indicators has helped us to improve the testing profile for our testing labs, as well as even the vendors' performance is easily monitored using such a program. So we want to work closely with everybody as a ministry to making sure that the program can continue moving, and we see the improvement should also continue even in our testing labs.
All right, thank you very much for that presentation. I think that was very informative. I hope everyone enjoyed that that example. And so we will wrap up the GHSC-PSM portion of this. So thank you to everyone here. We really appreciate your attention in all of this. I know in our in the chat here, you can see a link to the first one of these presentations, and certainly feel free to reach out to any of us if you feel that that would be useful. But I will turn it back over to our ASLM colleagues now.
Thank you. Thank you very much, Richard, Zephania, and Jason, their excellent presentation. Just to note that you cannot improve what you cannot measure for sure, but also clearly the validity of the measurement must be top notch, because then you get directed in the right direction in terms of improvement work. Again, also we've seen the listing of all the key KPIs, all the key, should I say, of the KPIs that are monitored in this initiative. And permit me again to note that you can measure almost everything, but then you want to pick out those key ones that are going to be your tracer areas to indicate your performance in terms of whether you're going in the right direction or not. And so we have quite a number of questions, and thank you, Fadzai, Jason, and colleagues who have been dealing with most of the questions already in the chat, but we still have a few that we'll deal with given the time that is available. And I'm going to put up the first question, and this is going to go to Richard. And so you've really taken us through the development of the KPIs, what they are, and some of these KPIs do have a cost implication to both the manufacturers, but also the vendors and the units, the user units, so to speak. So at what point do you advise that we should develop and specify the KPIs that are going to be monitored? Should it be prior to contracting, during the implementation of the contract, or after contracting? So at what point should we consider the development and specification of these KPIs for its smooth implementation?
Yeah, excellent question. So in our case, we designed our KPIs from the beginning. So before we actually implemented our service level agreement, we negotiated with the suppliers to put those key performance indicators into the service level agreement itself, and to make sure that the benchmarks, so the requirements for those KPIs, were also identified. So we encourage that the KPI management really be part of an all-inclusive service level model from the beginning.
Great, great. And should it come after the start or when the agreements are already in place? What are some of the considerations that the parties should take to ensure that they can still have something, because we're dealing with multiple situations here? So should it be considered after the contracting is done? What are some of the considerations you would advise?
Well, I would say that, in the event that some contracting is already done, I think, it does bear some negotiation with the suppliers. So as my colleague Yulia noted, the targets were included in our RFP, but then also negotiated before the contracts were signed. So certainly, in order, because I'm sure the suppliers would enjoy continuing to sell their products to the various buyers here. I'm sure insisting that, as part of an upcoming contract, an additional agreement could be raised for future years. So I think it should be part of the contracting process. So when it is kind of brought into play, that's probably the best time, instead of maybe just saying like in the middle of a period, like, hey, we want to do this. I think it is probably because, as someone here in the chat has noted, the supplier teams are not always very happy about it. So I think having a more formal process for raising the KPIs and establishing them is very important in order to make sure that everyone is coming to the table at the same time and in a collaborative spirit, in order to make sure that these things can be implemented effectively.
Great, thank you, Richard, there. And again, let me take it to the next question. And this is coming from a colleague who sent it directly to me. And it draws from the conversation that Jason indicated, that monitoring the KPIs really provides you that objective data that then gives you that leverage to have a very productive conversation with our global manufacturers. But there is this question on the adopting this approach. Should we apply it in situations where we have outright purchases and so we have the maintenance contracts as well running alongside, or do you encourage that this can only be for those reagent rentals and lease agreements? So can this be applied across the board?
So we've had situations in a handful of countries where we actually have had capital procured instruments as well as the introduction of leased instruments. So we have a mix of outright procured versus leased. And the same KPIs actually apply to both. You can, if you have an all-inclusive leasing arrangement, which we encourage, or if you have a supplemental service and maintenance agreements, those KPIs should still be attached to that service and maintenance agreement. I think it's important, as I mentioned earlier, establishing the expectations of service delivery upfront and in collaboration with the manufacturer, so that you're all on the same page. It's not enough to say that the manufacturer will provide service and maintenance. You have to be explicit in saying to the manufacturer, our expectation is that you will respond within 48 hours and you will fix machines within 3 or 4 business days. Set that expectation up front, and that's how you manage that dynamic between you and the manufacturer. So it's very important to set the goalpost up front. With us on the service level agreement, we have a unit price per test, which includes all of those elements, right? Including the expectation. So you alluded to, Francis, earlier, that the additional cost elements for doing this on the manufacturer side to be responsive, those are embedded in the price per test that we pay for those services. So if it costs them $100,000 to respond to X, Y, and Z, that's covered. We don't have to pay extra. We've already paying for it as part of our all-inclusive deal. So it's very important to set up those expectations up front. Very important.
Great.
irrespective
Great.
irrespective if they're leased or outright procured instruments. You still have an arrangement for service.
Great. Thank you very much, Jason, there. Let me get it to Zephaniah, and Richard, you can also then step in after Zephaniah, but just on the management cycle of the key performance indicators. And you spoke to the fact that once the reporting is done by the manufacturer, either on a quarterly or on a yearly basis, there is that aspect of verification of reports by the users, so to speak. So kindly confirm, Zephaniah, if therefore the routine data collection on each of these indicators are done at the user level and also at the manufacturer's level, so that then when you're doing the verification, you also have something that you have to refer to. So there is duplicate data collection on the indicators that we are speaking to here. Kindly confirm that and how it is playing out in Zambia.
Yes, I would like to confirm that both ends we confirm that the information that is being shared is actually correct. We do not want to have information that is not correct. No wonder we want even the end user should have the confirmation as well as the vendor, including ourselves as central at the ministry. We want also to verify such information because we remember that the service level agreement, we want them to be moving smoothly. Remember that the supply chain is not supposed to be cut at one point or another. So having information from the end user, who is the testing lab, as well as the vendor, as well as ourselves, it helps that we maintain information that is correct from both ends without bringing a lot of challenges in it.
Thank you. Richard, do you want to add to that, or Zephaniah has dealt with it adequately?
I think I'll just add one small thing, one very small point, and that is just to emphasize how we have in Zambia, for example, we have established our vendor and instrument performance management agreement that has been signed off by their Ministry of Health, which allows us to get the real-time information on testing numbers and error numbers specifically. So which then further improves the ability of us to validate that data, not just by a manual collection level by the lab staff or by the reports from the suppliers, but that, and this applies to all stakeholders. So PSM, Ministry of Health, CDC, USAID can all at any point in time log into a platform and verify those testing and error numbers as well.
Great, and we have one interesting question that we'll end with, and I will give it to probably Jason. Jason, there is a question on what penalties then do we get out there should we have perennial defaulters showing up in our space?
So I think we've been relatively kind to the manufacturers, right? We don't look at this as punitive at this point because, and I'll be honest, that the manufacturers have been pretty responsive when problems have been identified. I do know of one particular country that actually does have financial implications if contractual requirements are not met. We have not gone that far within PEPFAR. Obviously, if you're dealing with a specific country, that's one thing. But when you're dealing with a global procurement strategy, having punitive financial measures in place can be very, very complex from a donor community perspective. But I think if you're managing this at a country level, that could be something different if it's local funding. But we have just tried to focus on using the data, making the problems aware, establishing minimum thresholds for performance expectations. And anytime something goes above that expectation, we expect a rapid response to drop it down below the expectation so that we're actually achieving what we would ultimately expect. So at this point, We have not been punitive. Now, if there is a high error code and high error failures, there is a potential here for us to get replacement product at no cost. So that's somewhat punitive, but we don't go after them financially. I think that the big punitive action here is if they cannot perform. There usually is another manufacturer in a country that can perform. And the biggest punitive action that we have seen in the past is completely walking away from that manufacturer and transferring volumes to the other manufacturer that is actually providing better service. So that actually happens, and I would say that that's probably the biggest punitive issue, but we don't go after them as individual organizations at this point. We allow their performance to dictate what the country would like to do, and it's up to them to respond in that manner. So at this point, no punitive financial implications directly from PEPFAR.
Okay, great. And we're getting to the top of the hour, but we'll just borrow 1 minute to deal with one interesting question again here. And it relates to the fact that in most countries, we have vendors that represent manufacturers. And so we do not necessarily have the real manufacturers therein. Maybe this may not apply to the global health supply chain team because they're dealing with manufacturers directly, but at the country level. So some of the indicator performance might actually not necessarily be related to the performance of the in-country vendor, but because of the link they have with the manufacturers. I do not know if we've got into situations like that and how then you can work around that to make sure that the two entities, the vendor and the manufacturer, are all aligned to make sure that the benefiting of entities or the end users do not lose out.
Mm-hmm.
Yeah, go ahead, Richard.
Oh, I was just going to say that we do have some instances where that is the case. And even though we do work with the manufacturers at a high level, we do also work with specific country vendors in some cases. And we do include their representatives as well in this KPI monitoring. And even though we maybe will hold the high level manufacturers accountable for it, obviously those people will with the implication that then downstream they will also hold the vendors that they work with accountable. This is very much so something that we do work with in many countries, and we could give several examples of that. But yeah, it is very much so expected that all kind of downstream aspects of the supply chain will also be affected as well by our KPIs.
Great, thank you. Thank you very much, team, Zephania, Richard, and Jason. And colleagues, we know that for every program, we need the commodities, we need the equipment. Without those commodities moving to the testing points, then we don't have programs. And so it's very important that we can keep a tab on the performance of each and every aspect that allows us to get these commodities in place. And now that we've reached the top of the hour, I will just ask one of my great friends here to do just the closing remarks. And I will give it to you, Jason. All these are my good friends, but I'll give it to you in the interest of time.
So I'll keep it very brief because I realize that we're over, but hopefully folks have kind of gleaned some of the elements of how we actually manage some of the broader overall performance metrics within the agreements that reside within the service level agreements. Again, I think anyone that is engaging with a manufacturer to develop any kind of service level agreement, whether it's for service and maintenance or any other particular kind of contract with a service provider, establishing your expectations definitively with KPIs that can be measured and monitored is ultimately critical to achieving success. And more importantly, I think we can all attest to historically a lot of anecdotal claims in the past that we have high instrument failures and we have problems in X and Y lab. But when you start collecting the data, it's visible and there's no refuting it. And there has to be CAPAs and preventive measures put in place to address those. So I would say that that is one of the things that has helped us achieve success within PEPFAR and some of the other programs that we're supporting. So hopefully, I do see that there's been some other emails or communications in the chat. Happy to follow up with some additional sessions with areas of interest. and maybe we'll see another webinar in the very near future with another topic that's somewhat linked to the service level agreements and KPIs and maybe pricing negotiations, those sorts of things, whatever folks are interested in. But again, I'd like to thank everyone for taking time out of their day to listen to us and hopefully take away some important messages. So thank you again very much. We appreciate it.
Thank you. Thank you very much, Jason,
Thank you
Zephania, Richard, and the team in the background that has been really supporting with all the answering of the questions. Again, we've come to the end of this, but there are many more in this scope that we'll be bringing up to us. And so keep on the lookout for our adverts and keep safe wherever you are. Do have the best of your day, afternoon, or evening, depending on where you're joining us from. My colleague Fitsam is going to put up the access to certificate guide. I see that coming through. And so please just take note of what you need to go through to get your certificates and CPDs that you may be, CPD points that are really critical for those who attend our sessions. And we'll do the same at the start of our next session. So just join a bit early. We'll be running a guide to how you can access your certificates at the start of the session. With those, do have the best of everything else, and we'll see you in our next session. Thank you very much.
Thank you.